Diabetes insipidus can be divided into two types. One, we have central diabetes insipidus. Second, we have peripheral or neurogenic diabetes insipidus. The first, central diabetes insipidus, the drug of choice for central diabetes insipidus is desmopressin. Desmopressin is an antidiuretic hormone or vasopressin analog. Whereas in peripheral or nephrogenic diabetes insipidus, the drug of choice is thiazide diuretics. So in these thiazide diuretics will increase the cyclic AMP in tubules and thus decrease the urine formation. Then these thiazide diuretics also causes dehydration. They also cause dehydration, and they also increase the reabsorption of sodium and water from the proximal portion of neurons. They will increase the reabsorption of sodium and water from proximal portion of neurons, and thus they will cause dehydration, and they will also cause increased cyclic AMP absorption in tubules and thus decrease the urine formation. So they can be used in peripheral nephrogenic diabetes insipidus. Other drugs used in central diabetes insipidus are thiazide diuretics, chlorpropamide, clofibrates, carbamazepine. All these will increase the action of ADH. They are thiazides, chlorpropamide, clofibrate, carbamazepine. These will increase the action of ADH. Then we have lithium-induced diabetes insipidus. The lithium-induced diabetes insipidus, the drug of choice is amiloride. Amiloride is drug of choice for lithium-induced diabetes insipidus. Then we have to learn some important points about vasopressin receptor antagonists. Vasopressin receptor antagonists, actually they can be two types, that is V1 receptor inhibitors and V2 receptor inhibitors. V1 receptor, actually when V1 receptor is activated, it causes vasoconstriction. So an inhibition of V1 receptor, it causes vasodilatation. So it can be used in congestive heart failure and hypertension because it will increase the peripheral vascular resistance. And then because in these conditions there is increased peripheral vascular resistance. Then we have V2 receptor inhibitors. V2 receptor inhibitors can be used in SIADH, that is it is used in SIADH. Then the V1 receptor, so the main vasopressin receptor antagonists are ralcobaptin. Ralcobaptin is a selective V1 antagonist. Then we have lixivaptan, moxavaptan, tolvaptan, which are selective V2 antagonists. Then we also have one more drug which is called as Konibaptin. Konibaptin is actually an intravenous, it can be given intravenous route. It is V1A or V2 antagonist. This Konibaptin has aquaretic action, which increases the water excretion without affecting the electrolytes in congestive heart failure. So it is used in congestive heart failure as an aquaretic, that is for increasing water excretion. So these are the important points about the vasopressin receptor antagonists. Thank you guys for watching. Thank you.